Welcome to the Gravity Doctors. I'm Dr. Brennan Spiegel. I'm a gastroenterologist. I'm a professor of medicine and public health at Cedars-Sinai, and I'm the author of the book Pull: How Gravity Shapes Your Body, Steadies the Mind, and Guides Our Health.
And I'm Dr. Lachlan Kent. I'm a cognitive scientist interested in mental gravity, so how body and mind work together to manage gravity overall.
And between the two of us, we're the Gravity Doctors. And so today, on this episode, I'm really excited to really get into the weeds with you on your own theory. This is the theory of mental gravity. So when we think of gravity, we think of it very much as a physical force, a force that pulls us down and that we stand up to, our muscles and our bones and these pumps and tubes in our body that are circulating blood and liquid and all these contents and so on. But we don't necessarily think immediately that it's a mental phenomena. And what does that even mean? So you often talk about Cathy Freeman, who won the gold medal. Was it the 400 meter?
400 meters.
That's right, in the 2000 Sydney Olympics. Tell us about what she teaches us about mental gravity.
So when we think of running, we think of it as a physical activity. But we know that for sport and like competitive elite sport, it's a mind game as much as anything else. So she'd done all the physical training to get her body into perfect physical condition, peak condition for that race. But on the night, in the race, it's about unlocking all of that potential, isn't it? It's about steadying her mind, making sure that she's focused, that she doesn't get overwhelmed by the pressure, because only, I think, a week beforehand, she had lit the cauldron. She's the first competing athlete, and she was the center of the world's attention. Like, that is a lot. That's a heavy burden for her to carry. She was also the first Aboriginal woman to win a gold medal. When she did win the race, she was the first Aboriginal woman to do so. So she was carrying the hopes of a nation, of her people, all of that pressure. It was such a mental game for her at that time. And what did she do? She found a place of stillness within herself. That's how she focused, quietened her mind, and actually channeled sort of forces within her, like what she found important to her, and made kind of the race feel meaningful. She wasn't just running for herself. She wasn't just doing it to win. She was doing it for joy. As a 5-year-old, she described the feeling of running as liberating and as though she just would float through the race. She was obviously a preternatural talent running-wise, physically, but mentally, she also had all the equipment there, all the tools to channel that feeling of liberation. That's what she needed in the race. Even despite all that pressure, she had to find that sort of inner child and just let herself run free. And that's what she did. And what she can teach us is how she did that. So she felt, and this is how she describes the race in the years since, that she was riding a wave, that she was floating on a cloud, that she didn't feel the sense of gravity at all. It's like her feet were barely touching the ground. They were just sort of gliding over. She didn't feel that pain. She felt it as sort of ecstasy. And it was the liberation and joy that she felt as a child. So this mental mind over matter experience that she had in a peak performance, I think, can teach us a lot about mental health and well-being in everyday situations. Because what we know, the science is very clear, that positive emotion feels light and negative emotion feels heavy. This is throughout, all cognitive science, mental health. We know this as a fact.
And that's the thing. It's not like a metaphor. We speak in this language. We talk about feeling high. If you're on psychedelics, people are high, right?
Yeah.
Literally ecstasy. Or feeling low. There's a verticality embedded in our language expression. Certainly in the English language.
For sure.
And I would imagine most languages.
It's universal.
Yeah, absolutely.
Yeah.
So it would be easy to say, well, that's just, metaphorical. But something like depression is as much a physical phenomena as it is mental. And we could even get into what is the difference anyway, right, between physical and mental. You're hunched over. You're physically hunched over. You physically can't get up out of bed.
Yeah.
You're looking down at your toes, exhausted, very physical experiences that are aligned with this similar mental depression too. So, when you're describing Cathy Freeman's mindset in the moment, it could be misinterpreted as just fanciful language.
Yeah.
When in fact, it was a very, very much a physical feat.
Yeah.
Where, feet in both regards, right?
Yeah,
Her feet
yeah.
were not touching the ground.
Yeah.
Yes, they were physically, but she felt a buoyancy, it sounds like.
Yeah, so she kind of transcended sport to become like a cultural icon, but in the way that she describes that experience, it's a form of embodied cognition. Like she is embodying her thoughts at that point. Like it's how she has trained her mind. And I'd go a step further with mental gravity, talk about grounded cognition, that it's not just the body, it's the body's relation to the ground, to the environment, to the force of gravity itself.
So I know there's research, for example, that shows how the amount of glucose circulating in your body, the amount of sugar essentially circulating in your blood, will determine how well you can judge the angle of a hill.
Yeah.
So here's something that you would think has nothing to do with how much sugar's in your body. You look at a hill and you're trying to size up how steep it is. So estimating its steepness, which is basically telling you whether or not to go up the hill. And it turns out if you have more sugar circulating in your body at that moment, the hill doesn't appear as steep to you as it does when you have less sugar. And this has been demonstrated in a controlled trial.
Yep.
Amazing. If you give somebody glucose versus a non-glucose control substance, it will literally change your perception of the topography in front of you.
Yep.
So that to me is very much an example of embodied cognition.
Absolutely. And I think, we just went through the Gravitype quiz, the Gravitype questionnaire, where there's a continuum from physical fortitude to sensing to mental gravity. It's a continuum of gravity management that starts in the body. The body is the orchestra, but the brain and the mind, they're the conductor. They're the part of the body complex that is, governing everything else, that's giving the timing, that's giving the sense of purpose or the sense of direction or the music that the orchestra needs to play. So I think what Cathy gave us was an example in language, but in brute physical fact of mental gravity at its best. To me, depression is an example of mental gravity kind of at its worst, at its heaviest, at its most negative, when negative emotion has overwhelmed the body and there's just a sense of being weighed down by your very sense of self. Cathy felt liberated. Depressed person feels oppressed by their sense of self. And I had my aha moment for this, where mental gravity came from, was a lecture, and this is just by chance. So I was 20, 21, 22 years old, so it's about 25 years ago. I was in an astrophysics lecture in the morning, and we were talking about black holes and Einstein's theory of general relativity and how black hole is when gravity overwhelms everything else, so that space and time kind of breaks off and you get a black hole. Mass and energy are so condensed that they break off from everything else. And then an hour later, I was, my mind had just been blown in that astrophysics lecture, and I go into a psychology lecture on depression. And we used very similar language. The lecturer used very similar language to say how a depressed person feels cut off from the world. They feel overwhelmed by negative feelings. They feel concentered onto themselves and down and low and heavy and slow. And my mind just pinged and went, we just used the same language. They're the same words. Is that just a metaphor? I don't think so. I think that's explaining a depressed person's physical experience. In terms of embodied cognition, there's still physics going on. There's still, the mind is constrained by the world around it, by its interactions with the world. And we kind of reflect the world back and say, if I'm feeling weighed down, I'm going to feel dark. things are going to feel negative. That was what set me on this journey of exploring mental gravity. It took me to a PhD where I was really interested in the sense of slowness that comes along with depression, because we know in Einstein's relativity, mass and energy, they cause a depression in space-time. That was the language that was used in that lecture. It causes a depression, like there's a trampoline. You can imagine the surface of a trampoline. Matter and energy pull the trampoline down, and that is a gravity well where space is curved and time has slowed down. So we're on Earth right now. We're on, sea level. Time is going, clocks tick more slowly here than they do on the International Space Station. That's a fact of the universe.
Yeah. Age faster up there.
Yeah, gravitational time dilation. So are depressed people experiencing a version of that because they're experiencing mental gravity? That was my PhD. And since then, I've been sort of generalizing the idea to other, not just slowness, but this sense of heaviness and downness. That's where we connected in our physical and mental approach, the gut-brain axis. How is the body, glucose levels, serotonin? It is a physical condition. Anyone who's experienced depression knows that it's a physical condition. But it's not just about the negatives. Mental gravity is not a negative. That's what Cathy Freeman has taught me about mental gravity, is that when you use it for peak performance and for good and for positive emotion, it can be a driver. It's something urging you up from below.
Right. So that gets to the ups and the downs of life. And as you're talking and describing, gravitational fields and the bending of space-time, and I'm thinking about the cover of my book, actually. Maybe we'll put up on the screen here, Pull, where there is a gravitational well and a figure in the middle of it making a decision about, how am I going to get out of this? And I think that's an important distinction too between a black hole and a gravitational black hole.
Exactly.
Is, as far as we know, once you get past the event horizon of a black hole, there's no turning back. You get sucked into that singularity, time stops, and you're nothing. We don't even know. I think we have no models as far as I know about what happens at that point. But I'm sure we have models, but what do I know? But with gravitational black holes, maybe you can pull your way out of it.
Mental black holes.
Mental black holes. Maybe you can pull your way out of it.
Absolutely. You might be in a gravity well, but you're actually not in a black hole, because people recover from depression all the time. There is treatment-resistant depression, and people live with it, a chronic form, throughout their lives. But for most people, depression is a brief episode, 1 or 2 weeks. So life's ups and downs, that's happening to everyone to some extent throughout their lives. We're always having, peaks and troughs, peaks and valleys. Like there are ways of describing that I think that are not metaphorical. It's not about the physical condition of the body right now, but it is about life overall. When you step back and you think about, okay, well, during those peaks, I was probably managing physical gravity better as well. I was having ups and downs. And it made me think of, we're launching your book tomorrow, which comes out on October 7th for order. And at that launch, there's probably going to be a glass of champagne. People are going to be toasting to you and your work. And what does that represent? Now, this is metaphorical, but I think it has a kind of a matter over mind effect. It actually represents something that is physical. So we have a flute. So you have champagne, you have bubbles floating to the top. You have this vertical axis, and it's meant to represent joy, happiness, lightness. There's something about that upward movement that makes you feel buoyant, that sort of gets the party started, gets things flowing, and gives you maybe
until it turns flat, by the way.
Until it goes flat.
When it's flat, it's not buoyant anymore.
So it's artificially giving you what Cathy Freeman had to dig really deep for in her internal resources. We've got it in a bottle. But what's the downside of champagne is it's a depressant. We know alcohol is a depressant. What goes up artificially is also going to come down. You get a hangover if you have too much. So there's another gravitational metaphor for negative response to initial up. So you might be grumpy, you might have low energy, you might be sluggish. That's almost like a temporary depression. Okay? So if that's the case, if we signify joyous moments with gravitational anti-gravity substances, can we, instead of matter over mind, can we use the theory of mental gravity? It's just a theory, but can we use that to create mind over matter in the same way Cathy Freeman did for people in everyday situations, including those who experience depression, where what's the motivation sometimes when you're depressed? You've lost the sort of will or the intrinsic motivation to get up and get going and overcome, and it just feels like an emotional challenge, like there's no energy there. Can we find ways of sort of hacking into the intrinsic relationship to gravity to create mind over matter and create a sense of lightness through things like a mindfulness meditation? We know that there's mental imagery happening here. It's not just physical. It's not just material. There are ways that the mind can simulate feelings of lightness. We can imagine them, and that can have a psychosomatic effect. We can sort of reverse engineer the process of feeling down and heavy to feel up and light.
Well, I think about virtual reality, which is something that we use a lot in our hospital at Cedars-Sinai. And most people think of VR for gaming and entertainment and that sort of thing. But we actually use it to treat pain and anxiety and depression. And so you can imagine that, let's say you're in a hospital room and you're in pain and you're literally lying down and you're exhausted and vulnerable and depressed and anxious and some horrible milieu of all these
negativity,
gravitational pulls on your body and mind.
Yep.
And then we try something like virtual reality where you get transported into this fantastical world with otherworldly physics where you can simulate blasting up into the sky and floating through the clouds. And, what we see in those moments, and we've studied this, is not only do people feel better, they feel lighter, they feel elevated, but their body responds. And we can see their stress hormone levels drop. We can see something called their heart rate variability go up. So not only does the heart rate slow, but the beat-to-beat changes in the heart rate are more, flexible and dynamic. We see, this is amazing to me, their white blood cell count changes. So, the inflammation in the body can change just by simulating in your mind's eye. You're not literally flying up. You're simulating in your mind's eye this upward, buoyant, otherworldly sense of flotation. And people will feel better. And even after we take the VR away, there will be a persistent, benefit that continues, almost like a tail effect that the body is reacting to. So I think that all plays into this way of thinking about mental gravity.
Absolutely. And so VR is like an assistive technology for mental imagery. There are ways to do that without assistance, though. You can get people to do mindfulness meditations where they create their own mental imagery. And just think of the word mindfulness for a second. That's implying that the mind is a container.
Full.
It's full. You're filling it with positive attention. You're attending to the present moment. That's what mindfulness is. You're attending to your body, your environment, and you're just noticing. So that's a mental space that you're inhabiting. It's a container. So you were talking about before, perceiving physical space depends on, glucose levels. What about that mental space? How do we perceive and experience that mental space? What sort of mind do we inhabit? And can we, through practice, through mental imagery, through visualization, through meditation, create a better mental space that maybe doesn't have these steep gradients in it, these pits and valleys that we feel like we've literally fallen into in depression.
Falling into a rut.
So we're representing that somehow in our mind through just changing how we think, even temporarily, but maybe consistently, change the landscape, the inner landscape that we inhabit that is connected to the body? And is there a feedback mechanism here? That it's the brain then affecting the body affecting the brain, and within that mental imagery, that's like a top-down effect. We're trying to change.
As I'm listening to you, I'm, of course, thinking about what you're saying and trying to visualize the connections between the mind and the body and recognize that they are not separate and distinct entities. It's one continuous system.
Yeah.
And it's like if you go on a cross-country drive. If you look out the window, you see a desert landscape, let's say, if you're in Arizona in the United States. And if you keep watching, it's going to start changing, and then it's going to change again, and then it's going to change again. But it's not like there's a literal border between the states.
Exactly.
There's this, and by the end, the world around you looks nothing like you're at the beach and there's water, but the entire journey was continuous.
Yeah.
And that's how the mind and body literally are physically oriented. It's just a continuous one system. But then I'm also thinking about how we have these inner landscapes we're describing here, and perceptions of our inner landscape. But what this discussion is about is gravity. And there's also this reality around us that is the universe that we're in, the planet that we're on, and the forces that planet exerts upon us. And so in the end, we are like sense-making machines. We are taking in data that the earth is giving us.
Yeah.
And like a computer, we take the data and then we compress it into ever more efficient forms until eventually it arrives into our mind's eye, and we have, whether it's a hallucinated space or however I can think of it, it's a struggle for me. See some model of the earth. And then the question is, how well aligned are you with the reality of our, like our metaphysical reality?
Exactly.
Right? And if you're misaligned with the fundamental force that gives rise to us, one could imagine how upsetting that must feel mentally and physically.
To feel fallen. And that's where my thinking about mental gravity began. That's where the theory came from about depression. And I think I was fixated on that negative side for a long time because it seems where mental gravity is so extreme. The effect on the body is extreme. But I think with an anecdote like Cathy Freeman, that gives us the other extreme.
It's like perfect alignment.
It's perfect alignment. It's energy,
and
it's freedom
practice,
and joy. And think of all
physical and mental practice.
And it was just everything had to align. The stars had to align. Like the crowd, everything had to go well for her at that time for that experience to happen. And she said it only happened that one time that she felt like she was on
it shows how hard it is to find that alignment. Just like when a golfer is in flow and they can just perfectly align their swing and just strike that ball, or any athlete that's in flow is just in that space where they are aligned physically with the object they're striking or throwing or targeting, and mentally they're aligned, like literally with the planet.
Literally.
Like if you're not aligned with gravity, like physically, how are you going to shoot a three-pointer?
Exactly.
Yeah.
So can we learn from those extremes and apply it in everyday life, in our typical milieu, the mix of positive and negative, life's ups and downs? Can we take from the extremes and apply it in systematic, evidence-based, scientific, embodied cognition, really formal ways that are helpful for people, that promote mental health and well-being? I've done a PhD in psychology, but I'm not a psychologist. I practice mental health promotion and prevention. So it's the everyday, it's the community-based. Rather than in the hospital or the clinic, what can people do every day?
Right.
How can we change systems that create negative outcomes for people, but how can we empower people within that?
That's the thing, is this analogy is not really an analogy, that's the point. This is the reality.
Yeah.
But if we think about mental gravity as a state of alignment, mind and body, with the pull of the earth itself, and misalignments are associated with a disorder, symptoms, pain, anxiety, depression, etc. All the phenomena of what I like to call gravity intolerance.
Yeah.
That's an overarching condition.
Yeah.
And we as doctors, and I'm a doctor, will, focus on the organ of interest and say, oh, you have this condition, and we label it as IBS, or you have that condition, and we label it as postural tachycardia syndrome. But really, they're all gravity intolerance phenomena.
Exactly.
And how the gravity intolerance is reflected in any one individual may vary based upon their unique features. But in the end, if we think of it this way, then the solution is pretty straightforward. It's minimize factors that throw you off balance, physically and mentally, and strengthen the ability to stay in balance, the resilience itself. How do you anchor yourself or continue to try and come back to the center every time you get knocked off? And how do we reduce the knockings?
Yeah. We interviewed Harmon about his experience in hospital and how one of his reflexive ways of coping was to engage with gravity, was to go for a walk. And that gave him a sense of empowerment over his health when the world was really crumbling down and he was facing, mortality. It was that internal sense of, I've got to do something about this myself.
And for those that didn't hear that episode, Harmon Clark
check it out. Yep.
A patient who I've known for many years, a friend who had very significant disease and was near death. And check out that episode where he tells us how he essentially defied gravity, mentally and physically.
Yeah. So me right here, right now, I'm experiencing a type of levity and joy that is similar to Cathy Freeman. Like, she channeled her inner child from her, thought of herself as her 5-year-old running just for the joy of it. So it was 25 years ago that I had the aha moment, and to be doing this now with you, Brennan, talking about mental gravity with someone who's curious and scientific, but is curious and wants to open up new possibilities. This is a real joy.
Yeah.
So thank you very much.
Likewise. Well, I think I'm feeling mental gravity too, feeling buoyant. We'll have to stick with the champagne bubble side of it and not the consequences, the depression side of it.
Yeah.
And, I think this theory is so valuable because it is fundamental and because it maps to such clear treatments. And when we really break it down, if health is about alignment, then we need to try everything we can to avoid being knocked off. But it is inevitable, and that gets to the idea there are ups and downs in life, and they are inescapable. So when those occur, how do we stay aligned mentally and physically with that anchor point? And the sooner you can find yourself back aligned, the better your quality of life and, in fact, your quantity of life too.
Yeah, and we're not discounting, pharmaceutical interventions, serotonin reuptake inhibitors. Sometimes people need those to find their sense of mental balance. That's what they need to fight gravity themselves.
Right.
We're not discounting any of that. It's saying in complement to that, a complementary approach is individual.
I prescribe lots of pharmaceuticals.
Yeah.
I'm a doctor.
Yeah.
I believe in them up to a point. And that's the balance. Speaking of balance, is finding that equilibrium between your own empowerment, your own behaviors, whether it's spending time in forests and in green spaces or outside in the sun, or ingesting vitamin D and other supplements that are evidence-based, or creatine if it's going to help you re-strengthen your body so you have physical resilience, or eating a serotonin-rich diet to help boost your gravity-fighting serotonin neurochemistry. We have another episode on that. These are all techniques, non-pharmacological techniques that we all have access to supplement standard medical therapy.
This toolkit and mindfulness, meditation, mental imagery, visualization, like for a sports person, that is part of the toolkit. That is an essential part of the toolkit, and that is all in your head. You have control over that.
Yeah, but probably not too much champagne.
Yep.
We don't
Moderation.
want the siren song of the immediate up sometimes has the long-term down.
Yeah.
So, well, I think that's a great overview, something we'll be coming back to, I'm sure, in future episodes of The Gravity Doctors. And if you guys enjoyed this episode, please like and subscribe as we build our community of biogravitational medicine practitioners.
Yep.
And check us out on thegravitydoctors.com and look forward to seeing you guys in the next episode.
Thanks, everyone. Cheers.
If you like that episode, please like and subscribe and tell your friends about the Gravity Doctors. You can also follow us on social media. Check out the book Pull, and you can also check out our show notes for tips and links to some of our scientific articles. You can follow us online at thegravitydoctors.com. You can follow me, Brennan Spiegel, MD.com, and Dr. Lachlan at lachlanKent.au.